Good evening to everyone. I do not have any pharmaceutical disclosures with regard to this lecture. I am Dr. Sharon Marie G. Marcial, an obstetrician gynecologist, and for this evening, I am tasked to give a presentation with regard to maternal nutrition. So to start off, ano po bang dapat na baseline, no? Even before a woman gets pregnant, ideally even before a woman intends to get pregnant, no? Dapat ang baseline po natin maganda na. The weight, the height, the ideal body weight for the age of the patient and her statistics, her body mass index should ideally be within the normal range. Although in reality, how many of our patients are actually within the ideal body weight? Iilan lang naman po, ano? So, what do we do with that, no? With those patients who are not within the ideal body weight? Well, first and foremost, we have to educate them, no? That for your height, your IBW is this. For your activities, your caloric intake should be this. No? Education is the key to making the patient understand what is ideal for her health, for her overall health. When a patient understands, she is more compliant. For our patient who do not have the ideal body weight, dapat po ba ibinababa natin or ibinabagsak natin yung kanilang present weight to the ideal body weight? No. What we could do is to advise and help the patient lose at least 10% of present weight. So for example, for a 5-foot woman who is 150 pounds, no? So ideally, her ideal body weight would be 105 plus minus 10, so 115. Pero 150 pounds siya ngayon. So, what we can ask and help her achieve is a 10% weight loss. So, we help her achieve a loss of 15 pounds over a period of months. So, it is a combination of sensible dietary intake and exercise. So, it is a decrease input, increase output scheme. Okay? Aside from the weight, we also have to see or look at the comorbidities. If the patient has any comorbidity, most common that we see in the clinic is hypertension, deranged glucose levels, or even anemia. No? When we see these comorbidities, we should correct this even prior to pregnancy. So, ang tanong ngayon is, what food to eat? What do we recommend? So, we have 5 basic food groups. According to the National Institutes of Health and to the American College of Obstetrician Gynecologists, the 5 food groups are necessary for a healthy preparation for a pregnancy and for a healthy pregnancy. The 5 food groups are fruits, vegetables, grains, protein, and dairy. When we say fruits, ideally these are fresh fruits, not the canned ones. For vegetables, when we cook the vegetables, ideally they are not overcooked. Overcooked vegetables lose their mineral and vitamin content. For grains, sa Pilipinas po, our most common grain, rice. For protein, this can be pork, beef, fish, tofu, soya. When we eat beef and pork, we follow a heart-healthy diet. palagi natin inuulit ito, but somehow it only makes a significance, no? If we know the illnesses that are associated with excessive intake of meat. So, pag alam po natin yan, no, as physicians, we should know that, no? We ask the patients to limit their beef and pork intake to a matchbox size portion. If they intend to eat chicken meat, we ask them to avoid chicken skin. No? Okay. So for the dairy, Filipinos are not known to be milk drinkers. So aside from milk, saan po ba natin nakukuha ang dairy, ang ating requirements for the dairy intake? We have low-fat milk, skim milk, o milk pa rin siya, pero hindi siya yung mga tipong full cream, no? Na we usually see our Caucasian counterparts take, okay? Ano po ba ang nasa dairy that will contribute to the nutritional value of our daily intake? Well, of course, we have those that can be taken from sardines, no? Yung mga minerals sa sardines. Sa dilis, yan, kilala natin yung mga yan, ano? Oo. We can also have the nutrients taken from shellfish, no? Mga seafoods, no? Crustaceans, no? These are not dairy, but their mineral and vitamin content are comparable to what we achieve with a milk intake diet. Okay? So ulitin po natin, 5 food groups: fruits, vegetables, grains, protein, dairy. Okay. Let's talk about on how should pregnant women take in such food groups. Like what was mentioned a while ago, we have portions, no? Portions, 1 ounce, no? Usually we see on labels, take 3 ounces of such and such, take an ounce of such and such. So ano po ba ang 1 ounce? Ang 1 ounce po ay equivalent to 1 slice of wheat bread. Okay? Or pwede pong ang 1 ounce ay half cup of cooked rice, pasta, or oatmeal. So if a woman takes in 1 ounce of rice per meal, kalahating cup lang ho yan. Regular cup, hindi po yung mug. Okay? Regular serving, haan nga dyan na sidsid, hindi ho yung compact, iniipit, pinagkakasya yung half cup, hindi po. No? So 1 ounce is 1 slice of bread, or 1/2 cup of these grains. Okay? So, kung ang recommendation po ay 2 ounces per day, then pwede siyang allotted ng 2 slice of wheat bread in a day, aside from the other food groups. Okay? Ito pong eating for 2. Ay, buntis siya, or buntis ako, our patient tells us. So, mga anak ng mga doktora, kain lang ako ng kain kasi I'm eating for 2. Well, actually, it is not eating for 2 per se. It is more of eating healthier twice. So the key word there is not 2. It is eating healthier. Okay? So healthier means more of the fruits and the vegetables. Okay. More of the fruits and vegetables, additional dairy intake if the woman can tolerate milk. Okay. For the rice, we stick with the 1/2 cup of rice at mealtime. Okay? Pag nag-rice na po, huwag nang susundan ng dessert na bread, no? No, it is per meal. So if the woman is to choose between rice and salad or rice and spaghetti, okay? By salad, yung mga macaroni, Filipino salad, no? Macaroni salad, no? May mga carbohydrate portions, no? So if the woman is to decide on a carbohydrate, isang carbohydrate kada meal, no? So pag nagpansit na siya, wag na siya mag-rice, no? Eh, ang Pilipino kasi, may rice na nga, ang ulam pansit pa, di ba? Okay, so it is more of eating healthier twice. Increase the intake of fruits and vegetables. So paano ba ang dagdag? Okay, for a singleton pregnancy, the additional caloric intake should be 340 calories. So ano po ba ang 340 calories? It is a glass of skim milk and half a sandwich. Yan po ang additional intake for a singleton pregnancy. 340 calories is a glass of skim milk and half a sandwich. So, hindi ho ibig sabihin na pag ang pasyente natin ay buntis, we tolerate na double ang servings ng lahat ng kinakain, no? It's just 340 calories. This is the recommended dietary addition to a pregnant woman's meal. Okay? The source here is ACOG and the NIH. Okay, 340 calories. Yan lang po ang dagdag. So, hindi lalamon, hindi ganon, no? May additional, and the additional for a singleton pregnancy is just 340 calories. Okay. Pagkambal ang dinadala, the additional caloric intake is 600 calories. Okay, 600 calories. Kung triplets naman po, additional of 900 calories. Teach our patients to be mindful, to read the recommended what we read when we go to the groceries is the price. No? Ang Pilipino hindi tumitingin dun sa caloric value. Ang tinitignan yung presyo. So we can reset our mindset so that we can start looking at what is equally essential, no? So that we can also teach our patients to do the same. Mahirap magturo pag hindi natin ginagawa. Okay. Then, of course, we have the very essential water. We have to teach ourselves and our patients to hydrate. Hydrate, hydrate, hydrate. At least 2 liters of water per day. So, yung 2 litro ba na yan, doktora, kailangang ubusin? Well, there are people who are not water drinkers now, but we have to encourage them to reach this goal. If they cannot reach the goal of 2 liters of water per day, then we can compromise. Okay, hindi ayaw umiinom ng tubig? Okay, subukan mong mag 1 liter ng water pero may sopas ka. 1 liter of water, tapos dagdagan mo, nagmamilo ka ba sa umaga? No? Nag-choco drink ka ba? Nagkakapi ka ba ng at least a cup or 2 a day? Pwede po sa buntis, no? You have to make the patient understand that if 2 liters of water a day is improbable for her, then she should at least take at least a liter a day plus other sources of fluid. In as much that I think we are nearly, no, all of us in the audience are physicians, we already know what is ideal with regard to dietary intake. Alam po natin yan. Mahirap lang kasing i-translate, no, sa pang-araw-araw with fast foods left and right, no? May mga pa-meeting na left and right rin ang kainan, no? Mahirap kasing we get lost in the translation, no? So, basic reminders such as this, no? Regular basic reminders such as this would do good for both patient and doctor. Okay. So, let us go to maternal health outcomes. Itawid po natin doon sa babaeng nagbuntis na at ngayon ay nagpapasuso. Okay? For our specific objectives, for this portion of the presentation, we shall discuss nutritional needs of breastfeeding women. We outline how breastfeeding assists in child spacing, mga papyaw, discuss breastfeeding management when the mother is ill, and review basic information on medications and breastfeeding. Nutritional needs of a breastfeeding woman. So the breastfeeding woman is advised to eat a variety of food. No? Recall 5 basic food groups. Okay. There's no special food to avoid unless, of course, the woman is specifically allergic to a certain kind of food. Other than that, wala naman pong bawal. Pero kailangan variety ang kakainin niya. Hindi puro apple, no? Doktora, apple naman. Oo, but apple, can cause constipation. So, dapat may variety, no? Oranges, puro oranges. Oh, that's good also. But it can also trigger gastric irritation, di ba? So, sensible intake. Eat a variety of food. No special food to avoid. And then the drinking, no? The hydration of the breastfeeding woman. Another guideline here is to drink to relieve thirst. Pag nauuhaw, uminom. Aside from yung regular intake niya, another guide would be if she feels thirsty, kahit nakaiinom lang niya, inom ulit siya. Okay? This is, of course, we've already ruled out any pathologic cause for excessive thirst, ha? Oo. What we are talking about here is yung physiologic thirst. Okay? For a severely malnourished woman, for example, medyo nahirapan sa pregnancy, bumagsak ang katawan o kaya talagang ayaw magkakain. And then, she's already malnourished based on standards and yet she's breastfeeding. Then we have to advise her to increase fat content intake. And of course, pwede nating simulan ng vitamin supplements, no? For a severely malnourished woman, o kahit na hindi severely malnourished woman lang, we increase the intake of fat content to replenish what is lost and to support not only the breastfeeding but to support the woman. Okay. How does breastfeeding help space pregnancies? Okay. Breastfeeding delays ovulation and menstruation because women who breastfeed, there is a hypothalamic suppression, a physiologic hypothalamic suppression, wherein the hormones involved in the hypothalamic pituitary ovarian axis are suppressed. So, pag suppress ang hormones na ito, there is no folliculogenesis, there is no dominant follicle produced, hence there is no ovulation, hence there is no chances of fertilization. Doon naman po sa matres, the suppression of these HPO axis hormones do not result to a thickening of the endometrial lining. Therefore, if there is no thickened endometrial lining, there is no menstrual flow that will ensue. Kasama na po dyan na wala rin yung progesterone, no? Wala ang estrogen. So, there is a suppression. Hence, a delay in ovulation and menstruation. If we use the method of LAM, the lactation amenorrhea method, ang kailangan po nating tanungin, no? Well, LAM, no? Lactation amenorrhea method is a natural family planning that is done by postpartum women, that can be done by postpartum women. And the main mechanism there is to breastfeed purely on demand. What can also guide us with the LAM are these questions. Mrs., niregla ka na ba? This is different from lokya, What can be a scenario here? Yung mga nagbibigay ng mamador, yung chupon, no? Pacifier. Those are quote-unquote dietary supplements for the babies, no? The women who breastfeed during the day but bottle feed at night, no? So, yung mga tanong na yon will constitute the essence of the second question. Yung anak mo ba more than 6 months old na po? Okay, so ulitin. Have your menses returned? Do you give dietary supplements or do you not breastfeed continuously per demand? Is your baby more than 6 months old? So if the woman answers yes to any of the questions, there is an increased chance of the mother getting pregnant. So, pwedeng niregla na siya, pwedeng yes, gumagamit siya ng mamador, ng dietary supplements, pwedeng yes, hindi continuous on demand ang kanyang breastfeeding, or pwedeng yung baby 8 months old na. So if the answer is yes to any of the previous questions, there is an increased chance of her getting pregnant even without regular monthly cycles postpartum. Okay. However, kung no naman po ang sagot to all 3 questions, the chances of a pregnancy is 1 to 2% at this time. So ano po yung time frame natin? Yung 6 months po na postpartum with the qualifiers of the previous slide. Okay? Can the mother breastfeed when Can the mother breastfeed when she is ill? Yes, the answer is yes. The ill woman's body makes antibodies against infection. The antibodies are passed to and through the breast milk. Okay, so aside from the fact that there is a self-adjustment dun sa katawan ng babae, no? Yung katawan niya mismo ang nag-heal, no? Through the illness. Yung breast milk po na pinuproduce niya ay tuloy-tuloy pa rin po ang antibodies, no? Nadala. So, breastfeeding is okay for the ill woman and okay also for the baby, whether the baby is ill or not with the mother. When the mother is ill, ano pong food ang kinakailangan niyang kainin? Supportive food, no? Ano bang ibig sabihin ng supportive food? Lots of soup, no? Hydration, a variety of foods, no? So pareho pa rin, the same food groups, but only an adjustment in the amount and adjustment to the illness. So hindi masyadong makanguya, walang gana, then you give soup, no? Hindi makakain ng rice kasi parang nabubusog ka agad, walang gana. So you give more of what? Bite-sized fruits, no? So same food group, an adjustment in the portions. Stopping breastfeeding during a maternal illness will give rise to mastitis. It will distress the baby from the abrupt disconnection with the mother, and there can be difficulty in resuming breastfeeding. So, ito po, these are the clinical manifestations of abrupt halt to breastfeeding. So, in essence, we don't want these, no? So, tuloy lang po ang breastfeeding and then tuloy lang po ang nutritional support to the ill mother. There are women who take medications either for an illness or for maintenance. So as physicians, we always choose the safe drug. Drug classifications during pregnancy are available, and most drugs that are okay for pregnancy during pregnancy are also permissible postpartum during breastfeeding, wherein most drugs naman pass through the breast milk only in small amounts and few affect the baby. A special precaution is when the baby was born preterm and is at present less than 2 months old. So for this, we have our friendly pediatricians, no? with whom we can collaborate. If we are unsure of the drug, for example, we are in an area where we do not have enough resources to ascertain the safety of the drug, what we can do is we continue the breastfeeding, we watch for the side effects, and then we refer to a specialized health worker. So kung kinakailangan po, for example, may seizure, and then we have a drug that is anti-epileptic but we do not know the classification, so the present danger of the epilepsy or of the seizure warrants the drug. The mother wakes up, is okay. Can she resume breastfeeding? Well, while waiting for further evaluation, we recommend continuing the breastfeeding until specialized evaluation is done. Anyway, when we refer, the key word there is collaboration. I think the referral will only take less than a week or even just a couple of days. So in the meantime, we let the breastfeeding continue, and at the same time, we give the nutritional support needed by the mother. So as as parting words for this presentation, we just have to remember the 5 food groups. Sensible eating, okay? And before we embark on a pregnancy or before we attempt to aid in preconceptional guidance, we have to check the basics, history and PE, weight, height, IBW, body mass index. We need to have a good baseline, probably not ideal, but a good baseline. And then we go on through the 5 food groups, portioning, decrease input, increase output. Okay? So with that, colleagues, I thank you for listening to a refresher presentation for all of us. We already know what is sensible eating, So it is just a refresher so we can help ourselves, help our patients. Okay? So good evening to everyone. I wish you a good night. Thank you.